I would like to know from your perspective, what is the key to creating more momentum? I mean, obviously, language matters. I think having statewide initiatives do matter, even if it is completely different in terms of how federal dollars are allocated versus state and local. But I do think having state chapters matter, and obviously messaging matters.
Yeah.
You are to put the thinking cap on and say, all right, this is what we're going to do, and this is how we're going to create momentum in a way that maybe Bernie was not able to do enough of. How do we take it to the next level from your perspective to actually not only getting a vote on it, but basically creating enough momentum where they just can't ignore it anymore, and then eventually it's just a matter of time before it does happen?
Part of it is building bench strength of candidates to run for public office who support this. A lot have, as you well know, you've done it. But we need to do that more. Earlier on that same panel, there was a young man in Tennessee who ran for state legislature. He came up short, but he hasn't given up. He's now working to try to help other candidates, encourage other candidates, other progressive candidates in Tennessee to run for public office and to help them figure out messaging. That's a big part of the work that I do as well, is to help candidates and help organizations and people talk about this. How do you communicate to people who have been brainwashed all these years? How can you communicate with them in ways that they don't shut down when you begin to talk to them about the need to change? You need also to push back against the propaganda and the lies. A big part also of the work that I'm doing is to point out just how these lies are convincing people to vote against their own best interest, what their tactics are. I'm working with advocates in Colorado and Connecticut and other states that are trying to, that are supporting progressive change in those states as well as in Washington, to help them push back against this propaganda. A lot of it is exposure and exposing the tactics of the industry. It takes time to do it because you're trying to overcome literally decades of propaganda, but you got to do it. You need, when I said earlier, though, that you need to have more bench strength, it's very, very important to get candidates who are willing to put themselves out, put themselves up to run for public office, to be equipped themselves. This fellow in Tennessee was telling me, and I'm sure you would identify with this, you run, but there's nothing necessarily that equips you to be as effective in messaging as you should be. So that's very important to help candidates. I was on a call more than a year ago with Pramila Jayapal and I think Katie Porter and some other folks who other members of Congress, and it was a call with candidates who were running for Congress, and it was in the primary, who supported Medicare for all, or were interested in knowing more about it and how to talk about it. So that has to go on. You've got to be able to encourage and help candidates talk about this and how to answer questions. And it's slow. I wish we could say that it can be done in the short term, but you've got to also realize this. You've got to be in this for the long haul.
Yeah, there's no question that was, when Jen ran for Congress against Wasserman Schultz, and I'm sure you're very familiar with her, she is a darling of the private insurance, big pharma industry. Her reputation precedes her with the amount of money she's taken from them. But I will say that what we did have in terms of a campaign advantage, obviously there weren't many, all things considered, especially for a first run, is we did have a really awesome person out in Sacramento who had worked for Google and was really identifying ways to reach, some more of that older demographic who is very dependent on already have Medicare or are familiar with the system and, what may be coming. We really were able to close the gap on a lot of voters when it came to Social Security expansion and universal health coverage, because even if you do have what we have today in Medicare, which is good, it's nowhere near as good as it could be. And I think that type of message needs to be duplicated nationwide. And it does take more work because, as you know, there's a lot of big tech censorship. And anybody who's going to be preaching a message of, we need to basically dismantle the private insurance industry and completely not dismantle, but at least render big pharma infinitely less effective than it is now in terms of how they are able to dominate the financial sector. I think that's something that does need to be duplicated. We're obviously huge fans of Nina Turner. Personally think that she's one of the true leaders of this progressive movement and can actually build the movement bigger than it already is, leaps and bounds, should she get to a congressional seat, which, knock on wood, we believe she will.
I do too.
But I do think we need to expand in different ways. I do think, as I'm sure you would agree, if you're going to pick off U.S. Senate seats, that's where the real trick comes into play, because that's where the really insane money comes in. You can take down a congressional representative with even $1 million. But if you want to take down a U.S. senator in a moderate-sized state, you're going to need at least 10 million, if not more. And to raise that kind of money, it's not easy, especially if you're trying to do it in small dollar donations. So I do think that that's one part of the equation. But I'm also curious to know what your thoughts are on potentially trying to duplicate the similar approach as the Democrats have been attempting to do, the non-corporate Democrats, if you will. What about the prospect of potentially having non-corporate Republicans run for office?
I think it's worth pursuing. I have talked with a lot of Republicans. There's some things that I've done in my advocacy. One is to try to advocate for expanding dental benefits. And I mention this in particular because there are a lot of progressive advocates who are advocating for having states license mid-level dental therapists in dentistry, clinicians who are similar to nurse practitioners. Organized industry is very much opposed to it. But there are Republicans who have been on board with this because from their perspective, they see this as a so-called free market solution to helping people get dental care that they need. I think it's possible. I also have gotten acquainted with a number of Republican state legislators, again, in my home state of Tennessee, who've told me about how they've been intimidated by some of these organizations like Americans for Prosperity, which is a Koch-funded,
yes,
as you probably know.
Charlie Kirk.
Yeah, they wield enormous clout in a lot of states, and I think there's resentment and how they, we talked about how corporations are able to push around a lot of folks. So do those organizations, and I think it is possible to conceivably talk to some Republicans, and I wouldn't bet the whole farm on that by any means, but I think it's worth pursuing. I'm glad you mentioned Medicare and seniors. I think it is possible to get more of them to understand the need for what we're talking about here and to push for it. When we talk about Medicare for all, I think it's really important to talk about improving Medicare for all, expanding it and improving it. There is no dental benefit in Medicare. There's no vision benefit, no hearing benefit, nothing, no long-term care. There's no cap on out-of-pocket spending. So the Medicare program needs to be improved, and you can really talk to seniors to help them, and they get this. They understand that if I've not met a senior yet who is not happy to be in the Medicare program, but they know it can be better. And why should we make them or require them to buy a Medicare supplement policy to cover their out-of-pocket costs? It makes no sense. And why do people enroll in these Medicare Advantage plans, which are operated by private insurance companies? Is because they've, once again, been bamboozled and sold a bill of goods by the insurance companies. But we need to really improve the traditional Medicare program by adding benefits and putting a cap on out-of-pocket spending. And I think that you could really win some seniors over if you can help them understand, here's what we propose to do for you and for future generations that say age into Medicare.
Yeah, I mean, one thing that is always comes up is prescription costs and what is covered and what isn't covered. And this absolutely affects seniors. Both of my parents get Medicare, and yet it matters where they get their prescriptions and how much things cost, and some things that they can get and some things they can't. And so that's with Medicare. So it's better, but it's still not great in terms of the pharmaceutical companies' dominance.
It's insane. I mean, I'm a Medicare beneficiary myself now too. I have a drug plan. and there's a Rite Aid close to me that's more convenient, but I can my medications would cost less if I go to CVS.
Right.
Why? It makes no sense, and I know why. I mean, I was around.
You know why.
Yeah, I know why it is, but we put up with it. We shouldn't put up with this nonsense.
Yeah, and I agree. And that was one of the things when I first started running, that you do tend to find that the single payer healthcare issue is definitely not as big among seniors. It isn't, because they have theirs. A lot of them are very entitled about it in a way that I've had to wait. You should have to wait. That sort of hazing mentality. And so
that's a boomer generation.
it is. And you know what? It is. And so there is that. But when you do explain that their benefits should even be better, then now you're kind of talking, because it's unfortunate that people need to be spoken to in a personal way because they can't just relate to everyone else not having healthcare. Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.